the way that I explain injectables to everyone is that when they're done appropriately, nobody knows. Did you get a good night's sleep? You look well rested. Is that a new haircut? When they're done poorly, everybody knows, and they look bad.
What she have done?
So true.
What is that?
I promise there's people in your life who do injectables and you just have no idea. And you're like, I'm so jealous. They're genetically gifted. It's like, or they, take care of their skin that way.
Welcome to Care Experts, a podcast dedicated to providing the inside scoop on health and self-care.
Make sure you join us each week for candid conversations with wellness and medical specialists.
Yes, real experts here to help you make the best choices for you and your loved ones.
I'm Melissa, a native Texan living in Atlanta.
And I'm Selah, a Californian through and through, and we're your co-hosts.
That's right. We're both proud moms here to have meaningful conversations with experts from all over the country who empower, inform, and inspire.
From cosmetic to dental and vet to vision, this is Care Experts. Oh, Melissa,
Why the sigh, Selah?
You know what? Because
Why?
I have not been getting enough sleep. And I feel like I can see it on my face. Do you know what I mean?
And don't you just love it when someone's like, "Oh, you look so tired." You're like,
Literally.
"Oh, thank you."
The worst. The
It
worst
really is the
comment.
worst thing
Why
that
do
someone
people say
goes. I think they think they're like perceiving or like feeling your energy, and they want you to know, like, I can tell you're tired.
It's
I
like,
can tell you're a mom now.
thanks.
But that is not any. No one wants to hear that.
I know.
Let's just put that out there. Nobody wants to hear that. What you want to hear is that you look well rested.
Yes.
Yeah, and like, oh, thank you. How do you manage with 3 boys looking so well rested?
Well, I hopefully will be going to our guest's office today because we are talking
Oh.
about
Oh, aesthetic dermatology.
I know. I'm
Yeah.
like, just fix me, okay? I'm never
Fix
going to get
whatever you
enough
wanna
sleep.
do.
Just fix
yeah,
me.
Yeah. But when we talk about aesthetic dermatology, that sounds like a really big lift. What does that entail, actually? Aesthetic
Exactly.
dermatology.
What is that?
What is it? And we're going to have our guest on to tell us all about it
Yes,
today.
Dr. Will Kirby.
Mhm. Dr. Will Kirby has a biology degree from Emory University and a medical degree from Nova Southeastern University.
He was selected to serve as the chief resident in the Department of Dermatology at Western University Pacific Hospital.
He's also a published author, a lecturer, and an advisory board member for dermatological publications.
Sounds impressive.
Yeah, I mean, you know what he is? He's a multi-hyphenate.
Yeah, he is impressive.
He was a multi-hyphenate before we had that term,
Yeah,
multi-hyphenate.
true.
Yeah.
Because he's also, by the way, appeared on more than 35 different television
Oh,
programs. So
my
he is
goodness.
definitely multi-talented.
Well, because he's been on Dr. 90210, right? He's been in reality
reality.
TV, right? Like he's been on Big Brother, not just on Big Brother. He won Big Brother
That
the
is
first
insane.
season.
I wanna ask
mean,
him
it's pretty
about that.
cool. Yeah.
Yeah.
And he's also been on soap operas. Did you know that?
Oh,
Yeah.
I
The Young
didn't
and the
notice
Restless.
that.
What? I
Yes,
know.
I want to find out about that as well.
Me
So much to
too.
ask him,
I know.
especially we want to ask about him being the dermatologist and chief medical officer at LaserAway.
LaserAway. I've seen those.
Yeah, they're all over
the country.
Yep.
Yeah, even on the East Coast in Atlanta.
No, so you
Yeah.
can go too.
Well, I'm
back
really
home.
interested. I'm really interested in learning more about aesthetic dermatology, and I'm interested in people not telling me that I look tired. I
Exactly.
want to hear you look so well rested.
So what can we do?
You know what? Let's bring in
Let's
Dr.
just
Will
bring in-
Kirby,
let's bring in
and he'll
the expert.
answer all of our questions. Come on in here, Dr. Kirby.
Welcome, Dr. Kirby.
Thank you so much. Happy to be here.
It's so good to have you right here in the studio with us.
Yes, we are so happy to get to know you.
Pleasure's all mine.
And you have done a lot of TV, right?
I have. I do. I have an entertainment background. I mean, it's not my bread and butter. I like medicine, but
Yes.
I've been fortunate enough to be involved in the entertainment industry.
Yes, Dr. 90210, a lot of different shows. And also we have in common, we both were on The Young and the Restless.
Oh, nice.
What did you do on Y&R?
I played a rival to the main a business rival. is
Wait,
what
so
I
you were
played.
actually acting in it, not like
Oh,
playing
yes.
yourself as a doctor.
No.
Oh.
So were you young and restless or one of the other?
I was mostly restless.
Oh.
yeah.
I
No,
think
it
I
was
was
a
a
long time ago.
restless.
It was like 20 years ago, but it was
really?
really fun. And you know what? My character is still. I'm hoping they're going to bring him back.
I mean,
you know?
I still hope to.
Wait, from the dead?
What? No,
Because
he
that's what
didn't
they
die.
do.
He didn't die.
No one ever really does. On
I didn't
those
die on
shows.
Young and the Restless. I could come back to
Right, we
It
should.
was all
we
a
should,
dream.
We should
Come back
push this.
together.
So let's put that out there into the
So
universe.
casting?
Yeah, Young and the Restless. We're ready to rock and roll. Melissa will come too. We'll
That's
just-
right.
Yeah.
We'll put her in. She's my long lost sister, you know.
Yeah, sister from another mister, honey, because that's what it'd have to be.
You would be a great my company got taken over, and now we're here. You know, we interjected some new energy into it.
that would
So
be
That's
great.
me.
And
That's
that's
me.
Melissa.
You know where I recognize you from? It took me a minute to place your face, but now I place your face. Isn't that
Wow, I
nice?
like
It's
that.
like my Dr.
You're a
Seuss
poet,
moment
you
for
didn't
today.
even know it.
I
Oh,
know,
no,
I
no.
know. I read a lot of Dr. Seuss. I have a 5-year-old. Big Brother. I remember watching you compete on Big Brother.
Wait, what? You competed on Big Brother?
I did okay on that show. Yeah, 2001. It was a long time ago.
Was
You have
it
a good
a minute
memory.
I
ago?
cannot
Yeah.
believe you remember that.
My background is entertainment
That's
reporting,
right.
remember?
Oh, right. So you remember. I do. Well, and did you, okay, so how did you segue into medicine?
I know, right?
So in 2001, I was on the show Big Brother and got really fortunate, lucky enough to win that. I was a physician at that time, but I was just finished my internship.
Okay.
So paid off some medical school debt.
That's nice.
And then went a few years. Yeah, exactly. It was good timing. And then went back to residency and completed residency in dermatology.
Okay. Wow. And now you are at LaserAway.
Yeah, I'm really fortunate. We're the nation's leading aesthetic dermatology group. We have more than 150 clinics. We're in 30 states.
I was going to say, I pass it all the time in LA, like multiple locations.
May I
right?
please, very formally and very seriously, invite you both to come in and get some treatments?
Well, what do you think I need,
yes.
Dr. Kirby?
It's not an insult.
I need
We
it all.
all need something,
No, I need it
right?
all.
I mean,
Sign me up. I'm there.
you know what?
Give me the whole
but
package.
Very seriously, I mean, you both have great skin, but very seriously, it's a function of not just treating, but preventing. So no matter if you like the skin you have right now, it's a function of keeping it.
Okay. Do people tell you you are a walking advertisement for
Yeah,
laser?
well,
Because your
I
skin
mean,
is amazing. If you're
From
listening-
over here,
Yeah.
I'm like, he is poreless.
Poreless.
He is formerly young and restless, and now poreless.
Thank you very much. I mean, I do.
Thank you.
I follow the
Here all
routine.
week.
You know, and we'll talk about that if you like.
Sure. I would
Just
love
some
to
things
talk.
are very
Please.
simple, and you want to get into that.
Yes,
Please,
please.
get all the
I
way
mean,
in.
the phrase I say all the time is, how do you stop a car? And people say, well, you put your foot on the brake, and that's true, but you have to first take your foot off the gas. So taking your foot off the gas is metaphorically, in this context, it's avoiding deleterious things, specifically the sun and smoking and, exogenous pollutants. So by far, the best thing you can do, dollar for dollar, is barrier protection. Hat, glasses, long sleeves.
Okay.
And then sunblock. And as long as you can commit to that, we get a lot more exotic, and we can do a lot of the things and really improve skin, but also maintain great skin.
That is so true. As you can see, I'm fair and freckled.
You have to protect yourself.
I do. And I grew up in California, so I've already had 2 rounds of skin cancer.
Real basal cell?
Basal
I don't
and
want to violate
melanoma.
your. Really? Yeah. So I mean, then you really have to commit to that great
I
sun
learned my
protection at all
lesson.
times.
Exactly. And my skin, I feel, had premature aging because of all that and not protecting my skin. For so many years, I was a swimmer, a runner, all this stuff. So now I've learned my lesson. But how do you repair from that if you,
So you took your foot off the gas, and now we have to put our foot on the brake to stop that process. So your skin inherently wants to heal itself, no different than any other part of your body. So there's a number of things we can do, and I always like to be very value conscious. One of my favorite things to do is just a nighttime prescription cream, a retinoid, and retinoids increase surface cell turnover. So you both referenced that you have young kids, and I have young kids, and if you look at a child's skin, it's gorgeous, it's smooth, it's soft, it's supple, and it smells good. And why is that? Rapid increase in turnover. And so people say to me all the time, Dr. Kirby, why has the dermatological community not created an anti-aging cream? And I'm like, we have. It's called a retinoid.
Yeah.
So a retinoid, a tiny little bit of this cream every single night, it will increase that surface cell turnover, and it will, so your skin, again, smooth, soft, supple, and it will produce collagen over time. So it's not sexy and it's not fast, but if you commit to it long term, that tiny little bit of cream will make a really big difference.
And increase your sexy, I guess. Does that
That too.
But I
for
did
that.
hear, and I used to use before I was breastfeeding 3 children for the last 6 years, that it has to be prescription, and you can't do that while breastfeeding.
Yeah, well, that is correct.
Right.
And there's other, I mean, we can get into that, which is, I'm of the personal belief, although I would never make this recommendation because I would follow what the FDA says, but I'm of the personal belief that using it topically, even during pregnancy, is probably safe. But during pregnancy, we're not going to test things, right?
right,
So no study will ever be done on women who are pregnant. I tell them, enjoy the process, go through the bonding, and then when you want, after that, then come in and we'll help you.
Okay, that totally makes sense.
I understand incorporating a nightly retinoid routine, and I understand the need for it to be a prescription, but what is it actually doing, and how much does each person need? And this is 3 questions in one. It's 3 questions in one. What is a retinoid?
Yes.
How much does each person need? And are there different types of retinoids depending on each person's skin type?
You put them in a great order there.
Thank
so
you.
a retinoid is a synthetic derivative of vitamin A. And so you can take it orally, and it's used that way for acne.
Is
and,
that...
and it's very functional that way.
Okay, that's the famous Accutane?
Yeah,
Right.
Accutane.
That's
And,
right.
and the Accutane that's a whole other subject, and
Sure.
Accutane has been stigmatized, but the dermatological community is very, very supportive of Accutane when used appropriately. And it is, life-changing, life-altering for teenagers who have really bad skin. It's a great product when used appropriately, just like any product. You just have to use it appropriately.
Right.
But in the topical form, not only is it the gold standard anti-acne product, but it's the gold standard anti-aging product. So again, what does it do? It increases surface cell turnover. And when you think about that, when you're rapidly turning those cells over, in anticipation of your next question, you're going to say, well, isn't that thinning the epidermis and making your skin thinner? Common misconception. Not only is that not true, it thickens the middle layer of your skin. So by making that top layer of your skin uniform, that we impart with beauty, with cosmesis. So the human eye, it deems uniformity of the skin to be beautiful. So if you look at skin that is uniform in terms of tone and texture, turgor, color, that's how we deem, don't kill the messenger, that's what we deem to be beautiful. It's just human nature.
Yeah.
So this is one of those products that imparts uniformity. So making your skin smoother, softer, supple is just a really nice way to subliminally, subconsciously show others that you are vibrant. There's multiple different strengths. It comes in different strengths, and it also comes in an over-the-counter option, which is a retinol. And retinols work really well too. So the prescription product, it's going to be the same value. It's going to be about the same price as an over-the-counter product because the prices have come down. And as you might imagine, the prescription product is stronger. Now, that's neither good nor bad. It's just factual. It's just objective. So if it's stronger, you're going to get more of the good side effect, but you're going to get more of the bad side effect. And the bad side effect might be a little bit of irritation, a little bit of peely skin, a little bit of redness at first, but you'll acclimate to that. So the key here, and I cannot emphasize this enough, you'll talk to people all the time, or I'll talk to people all the time, who say that I can't use a retinoid or a retinol because it's irritating for my skin. And the answer is you're using too much.
Right, you have to use a little bit at a time.
A pearl size amount is enough for the whole face.
So, okay, when you say that, though, Dr. Kirby, and not to put my finger up, for those of you who are not
Is this a
watching and
Senate
just listening.
inquiry? I'm
No,
on the
it's
team.
not a Senate inquiry, Dr. Kirby. When you say a pea-size amount,
Yes.
oftentimes with skincare, it reads that a pea-size amount, okay?
Yes.
But when you're applying it yourself, I think pea means, a pea here, a pea there,
Right.
a pea
Oh, good
there.
question.
But when I go have my facials, I've noticed it's here in her hand, here, and then it's around my face. So I've tried to incorporate that technique. Is that what you mean by a pea size amount?
I like that you called me out on this because you're 100% correct.
Okay.
The amount you need total is the size of a green pea or the size of a little pearl.
Total.
Okay.
At total.
I know. It's
And-
mind-boggling. Like,
How is that going to cover my whole big face?
big face?
Let's get more granular though. Let's stop and talk about that really quick. Well,
Okay.
the way you use it is that pearl size amount on the finger, and then that's all you get, and then dab, 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 thin layer. Because it doesn't matter how much you use,
Okay.
it matters how long you use it. So human adult skin cell cycle turnover is 35 to 57 days on average. Okay, so call that 4 weeks to 8 weeks.
Very
And what that
specific.
means is it is specific, and of course, if you're, in children, it's much faster. That's the point, is they have rapid
Right.
turnover.
Which is
Those of us who have a little more life maturity, it's a little bit slower. And so we want to increase that turnover. And that's what this product does. But 35 to 57 days, 4 to 6 weeks, 8 weeks is going to be how long it takes to work. And so when you start using it, what happens? You put that pearl size amount on, nothing happens.
Right.
You put that pearl size amount on, nothing happens. So you're like, you know what? I'm special. I'm going to put a lot on. So you put a lot on, and then you get irritation, and you
Yes.
say, I'm too
I'm
sensitive.
peeling.
The key is consistent.
Okay,
Peeling, I'm
consistent.
irritated, I'm red.
Yeah,
So
I
the
made
key
that
here is
mistake.
consistency. You're not going to see a result for at least bare minimum 4 weeks, more likely 6 weeks, more likely 8 weeks. So you have to look on the calendar and say, you know what, I'm committed to this process. I understand what I'm being asked to do. Let me look on the calendar and let me do a tiny little bit all the time, and that will achieve my
And you
goal.
should track it with photos. Now it's so easy.
I love that. It's so
Yeah.
easy on your
Oh,
phone.
that's a great idea.
It's really simple to do. Just put a reminder in your phone. Hey, it's been 8 weeks. Let me have an honest conversation with myself in the mirror. Now, after 8 weeks, maybe I do want to increase either the strength or the amount.
Right.
And
Now-
you do a little bit bigger than a green pea.
So there is no one size fits all when it
Correct.
comes to that. I just wanted that was a
You're
question
You're exactly
3.
correct.
Well, that actually leads to my next question is if it's a retinol cream that's not prescription over the counter, how much of that is actually retinol in there? And when they say dermatologist approved, that it's
that's
been
my favorite.
tested.
Yeah.
Yeah, like how
Two very
accurate?
different questions there. So
Okay.
if they have if it says retinol in there, well, then I trust that the FTC is doing their job and that it's appropriate. Of course, again, when it's over-the-counter retinol, and that's the cousin of a retinoid, a prescription retinoid, you're still going to get a nice clinical outcome if you use it appropriately for long enough, but it's not going to be as strong. So you're not going to get, you're not going to get as strong of the good side effect, but you're also not going to get as strong of the bad side effect.
Okay.
But, given the option, the prescription is probably considered superior.
Probably better.
Now, in terms of dermatologist approved, that's a whole other, like in my industry, that's really controversial. There are labs where the dermatologists will, supervise these studies. But, I'm a dermatologist, and certainly no company is coming up to me and saying, are you approving this product? And, the analogy I make there is in the dental community. I have friends who are dentists, and all the time they say, every toothpaste is like, 9 out of 10,
Yeah.
9 out of 10, dentists
recommend
recommend this.
this.
And the
Yeah.
dentists that I know are like, no one ever asked me. So I'm a fan of the over-the-counter products, and I
Okay.
love the experience. My daughter loves to go to Sephora. It's fun. And even at Target and Walmart these days, you can get phenomenal products.
Really?
Yeah.
And what I tell people all the time is you can spend a lot of money on a good product, or you can spend a reasonable amount of money on a good product. And so it's really a function of the experience and how those products make you feel.
And how they make you feel.
What is the determining factor for that? Like defining what is a reasonable product that's going to work well, a reasonably priced product that's going to work well for me, because as you said, there is no one size fits all.
Correct.
Versus going to a dermatologist who is giving me a prescription for a product.
Yeah, when you go to the dermatologist to get the prescription, they're making a medical recommendation, and they're not going to talk about the other difficult to quantify aspects of the product, probably like the cohesivity and the viscosity and the fragrance and the color and the branding and the marketing and the label and all these other things that that factor into the overall experience. So I still think it's important to have a routine that you'll follow. It doesn't have to be a complex routine. Certainly doesn't have to be an expensive routine. But ultimately, I'll make this analogy with a similar question. People say to me all the time, what's the best sunscreen? What's the best sunblock? And I say the single best sunscreen, single best sunblock, and I cannot emphasize this enough, is the one that you like best. Because if you like it best, you'll wear it. If you think it's sticky or thick or tacky or smelly, then you're not going to wear it. So that's not the right one for you. So the more important thing is kind of committing to the process, whatever that is for you as an individual.
That makes sense. Now, what about, you said the whole package that you were offering us? What is
I'd love to see you guys in.
to this package?
What's happening later today, Dr. Kirby?
Well, then can I tell you why you guys why we'd love to have you as patients?
Yes.
It's because we love patients who are inquisitive. Because the word doctor is derived from the word doctorate, which means to teach. So I love to teach, and that's what I think. If you said, what does LaserAway do best? By far, the thing that we're the best at is teaching. Because we want to provide you with the information so you can make informed decisions, because it isn't one size fit all. You're not going to come in and say, hey, this is what you should do. It's not what we do. We inform you, we provide you with information, and then you kind of make a decision, and we want to work with you in that process.
Oh, that's so cool.
So the answer to that question is, we will provide you with information, teach you about everything, and then kind of, again, I'm repeating myself, but work together to figure out what you're trying to achieve.
What the program is.
Yeah.
Okay, so that's what you meant by come in, we'll give you the whole.
Well, and obviously, as the name suggests, we emphasize energy-based devices and injectables we have, and then topical products as well.
Oh, that's so cool.
What kind of
Yeah, what
injectables do you offer?
Well,
us
the
all.
injectables really falls into two main categories, and one of those is neuromodulators, like Botox Cosmetic is sort of the most common one. Everyone knows that brand. It's one of the most well-known brands in the world.
It's a household name now, right?
Xerox, Coca-Cola, Botox.
Kleenex.
Kleenex. It's a very. Why do they all have X?
Band-Aid.
Xerox, Kleenex,
Very good
Botox.
question. Wait a second.
I think we're onto something here.
X. Yes.
But so needless to say, those are great. And any the way that I explain injectables to everyone is that when they're done appropriately, nobody knows. Did you get a good night's sleep? You look well rested. Is that a new haircut? When they're done poorly, everybody knows, and they look bad.
What she have
So,
done?
So true.
What is that?
I promise there's people in your life who do injectables and you just have no idea. And you're like, I'm so
Absolutely.
jealous. They're genetically gifted. It's like, or they,
Oh, yeah.
take care of their skin that way.
Exactly.
And then the other type of injectables are fillers. So fillers, as the name suggests, volumize. And by replenishing some lost volume over time, you can impart cosmesis. People say, what exactly do you all do? And it's like, Well, of course, we beautify people, but the phrase I like is cosmesis. We want to improve cosmesis, which is just overall beauty. And any stigma associated with that concept hopefully is disappearing over time, because I think we're at the point, a time in the world where it's fine to look good. It's fine to feel good. It's fine to really put yourself first in terms of your grooming habits and things like that.
Yeah, I know. I really think the stigma is going away, and people also are interested in preventative skincare, like you talked about.
That's so important these days. We call it prejuvenation.
Yeah, oh, I love that.
Oh,
That's
cool.
like. But you both have great skin. I think we can all agree with that, right? Well, why don't you lock it in?
Well, but also, why? Like I told you before, I was really taking care of my skin. I guess it was 15 years ago now, I started doing Botox. When I was 26, I was like so heavily wrinkled for someone my age because of a background in theater and very expressive personality.
That's 100% true. Absolutely.
So now I feel like my skin actually looks better than when I was 26, 27,
You're both correct, but people who have that big personality, whether it's in theater and entertainment or just, they're in sales or whatever, and they have a big personality, they talk with their hands like me.
Yeah.
And obviously I use neuromodulators. I can't move all that much. Certainly I'm no hypocrite.
Yeah.
But people who are going to use more facial expression are going to have more fine lines and wrinkles.
Yeah, of course.
And how does Botox work to smooth those wrinkles?
Yeah, I love this question. So Botox, people say, I would only use something natural. I would never use something like Botox. Botox is wildly natural.
Exactly.
I mean, it's a derivative of a naturally occurring, botulinum.
Exactly.
And that in itself sounds kind of scary. What it does is it simply prevents communication between the nerves and the muscles. So right now, if your brain tells your muscles to get surprised, I can't do it. Maybe you can do it. Tells your muscles to get surprised, they'll get surprised. And Botox simply prevents that communication. So even though in your mind you're telling your muscles to get surprised, you can't display that emotion.
Crazy. Now, why is it I find I just started doing it again because post breastfeeding? Why is it that it is only like a month and a half when I'm supposed to be able to get 3 months out of it?
So, and that is not at LaserAway. So,
If you wanted to point that out, that's why we have to go this afternoon.
Yes. Okay, this afternoon, let's do it.
most neuromodulators are FDA approved for 12 weeks. That's their FDA approved indication. But we know that dose is duration. So if you want them to last longer, and we can make them last much longer, you do a higher dosage. If you want them to look a little more natural and last not quite as long, you can do a lower dosage.
Okay.
Now, just like I said with the retinoids, the good and the bad go hand in hand. The stronger it is, well, it's going to last longer, but you're also going to have less expression.
Okay.
And when you use less, it's going to soften those lines a little bit, but it is going to, and not give you full removal of that movement, but it's not going to last as long.
Right.
So as somebody who, you in the entertainment industry really have to use your face for more expression, you probably don't want to be frozen.
Exactly. I don't. Yeah.
Some people do want to be frozen. People come in all the time and they say, I still have movement. And we're like, you're 98% not moving. I like to not have much movement. It's just the way I like it.
But you're right. The nurse or the person who did mine knows I'm an actor.
Exactly.
Yeah.
So you can always go stronger. And if you're going on vacation and it's not pilot season and you're not working, go stronger. And it'll soften those lines. But if you're in front of the camera, you're kind of, you want to have a little movement.
For sure.
Can we go back to Botox just for a second? When she's saying that, okay, it's not lasting as long as I would like, and you're saying, well, also maybe they're not giving you as much because you're so expressive and you're an actress and all of that. Is it also because of her metabolism?
I've heard
Is it
that.
That could be a
like
role.
is your body metabolizing the Botox
I think because
really
I
quickly?
sweat a lot while I work out.
I'm just curious.
That's a
about
great
that.
question.
Yeah.
So that certainly could play a role. And
Okay.
in fact, going back to what you said before is you're doing it post breastfeeding.
Yeah.
Which is, of course, the safe way to do it. It's the only way it should be done. But that means that for at least a year, you didn't use it.
Yeah.
So, muscles become hypertrophied when you work them out. And facial muscles don't get like what you think of as like hypertrophy in the shoulders and the chest and the back and the arms, but they still get stronger. So when you didn't use it, those muscles got stronger. So if you used a certain dosage prior to pregnancy and you're using that same dosage now with more time have passed, it's not going to last as long.
That makes sense.
That makes sense.
Yeah.
That's why he's
I
Dr.
know.
Kirby.
Well,
That's why
there you
he's
go.
Thank
the
you.
medical expert.
The expert.
Here's the good news. When you are consistent with it, the same dose will last longer and longer and longer because you're keeping those muscles purposely weak.
Atrophy.
Ah,
Yeah,
Exactly,
that makes
atrophy.
sense.
I don't
Okay.
love to use the word atrophy. That is correct. That is
But-
100% correct because we associate atrophy with like wasting and like something
Right.
bad.
Yeah.
But it is the opposite of hypertrophy.
Exactly.
So we're not trying to make those muscles smaller. We're just trying to make them go to
weaker.
sleep. Go to put
Yeah,
go
go
a
take
little
a little
baby to
break.
bed a
Rest
little
a little
early.
bit.
I don't
Rest
need
a little
doing
bit.
Exactly.
Dr.
Now-
Kirby, you're making this so like digestible. No,
Thank
honestly,
you.
like, I didn't understand what Botox really did other than
Freeze
forgive
the
me,
face.
freeze the
Of
face.
course, of
No,
course.
that's
And-
because in layman's terms, it freezes your face. That's what. But
And
you're
some
making
people
it way
want to
more
be frozen.
comprehensive and
typical.
understandable in a way that I think people can walk away from and go, "Oh, I get it now."
I know.
So can I tell you one more thing about it, which you'll
Please.
find interesting? I wasn't going to bore you with this,
You
but you
won't.
guys seem interested. So all neuromodulators, Botox, cosmetics, Zeman, they have a biological life. And what that means is you get injected and nothing really happens for a day or two.
Yeah.
Then they start to kick in, they get strong, they start to get stronger, and then that slowly wears off over the course of about 3 months. But at 2.5 months, it kind of falls off precipitously. And if you said to me, when's it going to be its absolute strongest? That's day 10 to 14.
Yeah.
Now, when is it going to look its best? I think it looks its best, and then again, this is cosmesis. This is all you
Cosmesis.
might differ than me. I think it looks best about 6 weeks after.
I
you
was
get an
gonna
injection.
say, I feel like it's about a month to a month and a half.
Yes.
And then after that,
Why
I'm
is
like,
that?
ugh. Because I still have a little natural movement, whereas like when it's first kicking in, I feel like
Yes.
it's too frozen.
You're frozen.
Yeah. And I can't smile. Or
I
you know.
agree completely. So
Yeah.
and the reason this is important is you have something important to do on camera. Map it out 6 weeks earlier. Do it.
Totally.
That
If
is
you're
so
getting
smart.
engaged, married, high school reunion, prom, don't do it 2
Right
weeks before.
before.
You're going to be frozen. And
I
and again,
agree.
that's not good or bad. It's just objective information.
Yeah.
So when sometimes people come in and they say, "I'm so excited, I'm getting married in 2 weeks," and I'm like, I make a noise like a car on the. I'm like, whoa, we're putting on the
That was
brakes.
really
Yeah.
accurate. Dr.
Let's
Kirby.
wait. Thank you.
Yeah.
Thank you. Let's wait until
like, I
you're
do that every
another time.
Now, can we talk about dermal fillers?
Of course.
Because I have never I did it once and it hurt so bad under
Mm-hmm.
my eyes. I literally looked like I got punched in the eyes.
Yes.
But also, I didn't really see results. Like, I didn't think I looked any different.
But I don't even. What is a dermal filler?
Yeah, so
yeah,
a
tell
filler
us.
fillers volumize, so they fill, right? And there's really 3 main categories of dermal fillers. The safest category is called hyaluronic acid, and that's a clear gelatinous substance that occurs in our skin, and it occurs naturally in our skin, and it coats our the end of our bones actually, because it's soft and it's kind of like a biological sponge.
Okay.
And this biological sponge can hold up to 1,000 times its own weight in water. So it's again, it's a synthetic derivative, but very safe, very natural, and it's used to replenish lost volume in the face. So as we age, you lose volume in places where you want it, and you gain volume in places where you don't want it.
Yeah.
And under the eyes is one of the areas where people lose volume as they age. And so it can be replenished in that area. It is exceedingly tricky. You have to have to inject in that area
Okay.
because you can bruise like crazy. You also can. It's better that you said that it didn't look like it did much because I'd rather it do too little than too much under the eye. I'm personally not a big fan of under the eye filler. I think it's overdone. I think it's done too frequently. I think it's done by people who don't have the proper training to do it. So we don't offer that mainly because one of the, and I'll digress here really quickly. One of the most powerful things we have at LaserAway is what I call our N number. An N number, when you look at any medical study, is the number of participants in that study. And because we've been in business for 18 years, and because we meticulously track absolutely every data point, we can look at millions and millions of patients, and we can go into that algorithm and find what they request and what they want. And what we find is that patients don't really request under the eye filler. So for us, fillers are much more used for lip augmentation. And again, I know what you're thinking, like bad lips. If it's done poorly, you notice and it looks terrible. When it's done well, no one notices. It just looks great. So lip augmentation is an area where we often do it. The nasolabial folds is an area to do it. Cheeks is very popular these days. Again, it's very natural when it's done appropriately. So fillers, not as popular as neuromodulators, but for the right patient, really beautiful cosmetic result.
One of my friends just got it done in the temples that she said it did something like, you know what I'm talking about. What is this called? That she did?
So you can do filler in the temple. Again, that is that's not FDA approved, which is still, we do things not FDA approved all the time in the industry, but I don't recommend it unless it's done by someone who's exceedingly talented. because that is a very vascular area, and it can lead to a lot of problems if it's done poorly. But why do people do that? It's because, again, I'm not trying to insult anyone, but as you age and you lose volume here, your face looks like a peanut. Like they call it a peanut head.
Yeah.
So like you look like Mr. Peanut.
I
So
call it the skeletal.
like Skeletor from He-Man. So
Yeah.
sometimes you can replenish that area with filler, but it needs to be done appropriately.
When we talk about dermal fillers and you talk about it looking when in the wrong hands, not natural,
Yes.
right? It seems just based on social media alone that there is an evolution towards the more natural aesthetic. How have you seen that evolve in your practice?
Well, there's trends all the time, and that's very, very accurate. And again, this comes down to the educational quotient. So sometimes people come in and they say, I want these giant lips. And you can say, listen, they're big enough already. They're not going to, it's not going to impart cosmesis from but for whatever reason, this person really wants it. And if they're, if they have a sort of a good case for it, well, our industry provides that. And unfortunately, they provide it all too often.
Yeah.
So what's great for our organization is that we don't have to make financial decisions based on what patients you want. Meaning, like, if a patient requests a bad idea, we absolutely turn them down because our reputation is on the line.
Yeah.
We're not gonna give. They're going to get that treatment somewhere.
Yeah.
Not gonna be from
Unfortunately,
LaserAway, no.
Not from
but
LaserAway,
it's
right.
not us to decide what is beautiful. It's for us to decide what's safe and what meets our parameters.
That makes sense.
So this does happen very frequently where people are overfilled. It's a function of patient selection and patient education, and those two things go hand in hand.
Yeah.
So the hardest phrase to say in the entire aesthetic dermatological community is the word no.
No. I
And
knew you were
people
gonna
don't
say
want people
that.
don't want to hear it.
Yeah.
And so but
Yeah.
we normalize that word and we say, look, no, it's not a good idea for you. And they'll go somewhere else and get it, and then they often come back and say you were right. And they trust you. Ultimately they trust us because we're going to give correct
Because you were
information.
willing to say no.
Exactly.
Thank you so much for joining us and being part of our growing community.
Stay tuned for new Care Expert episodes every Wednesday. And don't forget to subscribe on your favorite podcast app and YouTube.
The information, opinions, and recommendations expressed in the episode are for informational purposes only. Information has been obtained from sources generally believed to be reliable. However, because of the possibility of human or mechanical error by our sources or any other, Synchrony and any of its affiliates, including CareCredit, collectively Synchrony, does not provide any warranty as to the accuracy, adequacy, or completeness of any information for its intended purpose or any results obtained from the use of such information. All statements and opinions are the sole opinions of the doctor being interviewed. The data presented in the episode was current as of publication. Please consult with your individual advisors with respect to any information presented. All product, service, and company names are the trademarks of their original owners. The use of any trade name or trademark is for identification and reference only, and does not imply any endorsement, sponsorship, or affiliation by or with the trademark holder of their brand.